Hi, my name's Louise Allen. I'm a consultant paediatric ophthalmologist at Cambridge University Hospital's NHS Trust, and we've put together this video primarily to help parents who are looking after babies, infants and young children who need contact lens wear and who'd just like a resource to get some tips and tricks on how to best put them in and take them out of their children.
We primarily use soft contact lenses with high oxygen transmission. They are normally very comfortable and they can be worn for long periods of time without any problems.
So what would you call a long period?
Although they can be left overnight, it is better for them to be removed at bedtime if possible. The lenses we use for babies and young children are often very high prescription. So they will be made to measure lenses rather than disposable lenses that lots of people use nowadays. Hence they will be thicker than the disposable lenses, and they will also be designed to last for several months. There's no doubt the daily wear is a better option because it gives the eyes a chance to breathe, and then this reduces the risk of complications of contact lens wear. However, this can be challenging. It's not without its difficulties, especially if one of the parents maybe has to leave early in the morning to go to work, and there may be other siblings that need attending to. It can be quite difficult for one parent to be doing this every morning. Hence, it may be a good idea initially to perhaps attempt daily wear at the weekends when both parents are about and time is less of a constraint. And then gradually, as the parents get confidence and the child begins to accept contact lenses as part of the daily routine, then they can progress towards regular daily wear.
If you can't tolerate that and you have to wear them as an extended wear lens, how often would you have to come back and have them changed? Well,
we normally try to see children every 2 months, 2 to 3 months, and replace the lenses, unless they're obviously in between appointments or with any problems. But I need to say that sometimes daily wear may just not be possible. Some children are more difficult, more challenging, and some parents will find it more difficult to put a lens in their child's eye, because often the child will cry or get upset, and this can be very distressing for the parents. And if parents find that they can't manage daily wear, they really shouldn't worry. There's perfectly acceptable to leave the lenses in overnight. They shouldn't feel inadequate, or they shouldn't feel that they're letting their child down in any way.
So some parents may wonder about how they know if the contact lenses is in or out, and what to do when it does fall out. What do you think?
Right. Because of their high prescriptions, contact lenses we use mostly for babies and young children have prescription only in the center part of the lens. And when you're looking at the lens on the eye, this looks like almost like a bubble in the middle. So and it's actually quite easy to spot. And so the idea is to really regularly check that this bubble, which what we call the optic portion of the lens, is actually in front of the child's pupil. If the child is not looking to the optic part, then obviously they won't be getting the benefit. So if the lens is slipping, this is something that we need to be made aware of very quickly. And it's also possible to see the edge of the lens on the right of the eye if one looks carefully.
And what should they do if they find it, on the bedclothes or in a nightie or whatever? What should they do with the lens?
When the lens falls out of the eye, it will dry up very quickly, within minutes. It will be a very small shriveled up bit of cornflake. That's the easiest thing to describe it. And if one picks it up very gently and places it in solution in a case, drops it in some solution, it will gradually rehydrate and get back to its normal shape. And they need to leave it for minimum 6 hours for the lens to be sterilized. And if they inspect the lens, if it looks intact, it's not damaged, the lens can be reinserted and can be used.
And what sort of fluid should they be using? Can you use tap water for that?
Oh, definitely. Contact lenses and water don't mix. This is the first important lesson, is that even washing your hands, you really got to dry them really well. Which also obviously causes problems with swimming and other issues as well, but definitely no tap water, please. So they have to use contact lens solutions like Opti-Free or some other contact lens solution.
And can you rinse out the case itself in tap water?
No. Some people do use freshly boiled cooled water, but nowadays the feeling is to replace the case periodically, just dispose of the case. I know we are adding to the plastic waste, but it is generally a better idea just dispose of it and don't keep same case for a long time.
So Ali, if a contact lens falls out, how urgently does the parent have to get that contact lens replaced?
Well, the main thing is to inform the clinic as soon as possible so that it starts the ball rolling. Ideally, the lens has to be replaced within a sort of day or two, but sometimes this may not be possible because logistically the lens may have to be ordered and then appointments have to be made in the clinic. And really, a few days is fine, but it's just the case is the point is don't sort of neglect it. One thing we don't want is if a child has an appointment in 2-3 weeks time, don't wait until the appointment tell us the lens has been missing for 3 weeks. Just let us know on the date and we'll be able to get the ball rolling and organize a replacement as soon as possible.
The other problem that can happen is that sometimes the baby finds the contact lens to be very irritable and sometimes the eye can go pink. What are the things that the parent should be on the lookout for that the contact lens is getting too dry, or whether there's a risk that the eye underneath is getting damaged by the contact lens?
Well, if the biggest risk we are concerned about is infection. And if there's an eye infection, often the child will be unhappy, they will be crying, it just won't be happy, the eye will be quite bloodshot, and mum will know that there's something isn't right. Whereas if just a slight irritation, slight redness, and there would be, parents could be looking out for it, but often the child won't be distressed from a sort of simple red eye from dryness. But obviously if there is any possibility that there may be an infection starting, then obviously the child has to be brought to the clinic, or clinic has to be contacted as soon as possible to arrange for someone to look at the eye.
Yeah, I found another quite important symptom is sensitivity to light, so the change in the child's sensitivity to light, and sometimes you can actually see a little white spot on the cornea, which can be the start of an abscess, so that's very important that they look for that as well. And really the contact lens needs to come out as quickly as possible.
Yeah.
So sometimes the parent may find that the contact lens looks a little bit cloudy. What can cause that?
Well, it's difficult to know because with some children it just never happens, others can be more prone to it. It could be to do with their tear film. It's often basically proteins from the tear film accumulating onto the lens. But yes, but obviously if the lens goes cloudy, then it means the child is not getting benefit from looking through it. So this has to be reported to us, and we may try to change a different material, perhaps a different polymers that may not cause the same problem, or we may prescribe lubricating drops for the child to use to stop the lens drying out.
And what sort of drops should they be after? Can they use any sort of drops from the chemist?
No, they have to be preservative-free, single-use, basically contact lens comfort drops, or that people can buy over the counter are perfectly adequate. And they can also have similar things on prescription, but as long as they are single-use and preservative-free.
Yeah, so they need to tell the GPs that they have to be preservative-free.
Yes, of course. Yes. Yeah. So the first thing is to wash and dry your hands carefully, and then basically you take the lens out of the case, and like so. And usually better to support the lens between 2 fingers, like a little taco, or even 3 fingers, whatever if a parent feels more comfortable. And basically then you have the other hand free to lift the child's top lid up, gently place the lens on the eye, and really keep sliding under the top lid until the lens is on the eye. And you may need to also pull the eyelid down, pull the bottom lid down, as the child will often squeeze his eyes and try to sort of fight back. Once the lens is in the eye, it will find its own place quite easily. So you don't need to worry about the lens being in the center. The lens will center itself quite easily.
Sometimes you get a little fold on the contact lens. What should you do then if you think that one of the edges has flipped? If
you then push the lens away from the folded area, often it's possible to fold it back. So that's thanks for mentioning that. Yes, it is possible. Often at the bottom it can be folded. So you don't need to take the lens out. Usually just slide it away from the area. Just try to gently fold it back. Okay, there are 2 different methods of slightly different techniques for taking it out. It's a matter of whichever one the parents find easier. A popular way, if I may just show you on this, we have a sort of like artificial eye with a lens, contact lens on the eye. To take the lens out, if you imagine my thumbs being the child's eyelids, you're pulling the eyelids apart and gently push towards the middle so the lens falls in the center, as you can see. It will just then fall out. If this isn't working, then the other method is to use your thumb and index finger and just squeeze on the lens, like so, to take it off. What you're actually doing is not so much pinching the lens, but you're squeezing it to break the suction, which is holding the lens on the eye. As soon as the suction is broken, the lens will come out. It won't stay on the eye anyway.
So much for us discussing how to put contact lenses in, but I think the real experts are some parents, and we're very lucky that we have Liz and Amy with their sons Ben and Ted with us to talk a little bit about the tips and tricks that they found works with their kids in putting their contact lenses in and out.
So Ben had several operations early on, and probably he's been wearing them since about 8 weeks, 12 weeks old. And initially the contacts are supposed to stay in for months at a time, but we realised quickly that his eyes didn't accept them very well, so we have to take them in and out every day.
And Ted, straight after his operation at 11 weeks old, he's 15 months now, we had about a week and then he started wearing contacts from then.
The most difficult aspect of putting in and out the lenses was at the beginning, when I felt very nervous about touching his eyes, and he was a lot younger and would cry and really didn't like anybody touching his eyes at all. So it was kind of getting over that mental barrier that we could do this and just keep going and it would be okay.
When your child gets upset, obviously naturally you don't want to hurt them, but
No.
and you know you're not hurting them by doing this, but and it's to improve obviously their vision in the future, but it's still hard when they're crying, so that's probably the hardest thing to overcome, just trying to block that out.
Yeah. I think sometimes it's really hard to get them in if for whatever reason they're having a bad day, or sometimes they just get a bit fiddly. I try really hard, but if you need to walk away for 2 minutes, put it down, do it, come back in 2 minutes, have another go.
Yeah, exactly the same, especially when we first started. Ted's, the first time I did it, it took a whole day of going back, coming back and forth. Yeah, and it's just perseverance, trying to block out again that they're getting upset, but also giving them a bit of time out if it is taking too long, because it's not going to help you or them.
So the most useful techniques that I found with putting the lenses out and in would be, firstly, when washing your hands, to make sure they're really dry afterwards, because if they're at all wet, it makes the contacts very slippy. Also, he has 2 big sisters, so they really help by singing and distracting, feeding, holding favourite toy. Sometimes you just have to get on with it and try and just do it as quickly as possible.
Easier said than done. We used a lot of bright, colourful toys that lit up and played music and things at the beginning to distract him. And then it's using different techniques as they learn and they get older and wiser, and yeah, just the quickest way possible.
Yeah. So as Ben's got older, I think the techniques, they haven't changed so much, but it's got a lot quicker. So rather at the beginning it was a lot harder or more drawn out, it's now, come on, we've got to go, make it far less of a big deal almost.
So Ted has started to do different things with his eyes as well. Now he's getting older. He'll shut it really tight, or he'll roll his eye into the back of his head. Different techniques. If he rolls his eye into the back of his head, I use my thumb to push his eye down with the eyelid closed and to push the contact down and then fish it out and hook it out in a different way. But yeah, there's all.
Yeah. I think after a little while you can notice if they get a bit fractious or if they're crying or rubbing their eyes, you'd know that a contact might have come out.
And especially with Ted's, when he's got his patch on, he wouldn't be able to see properly without his contact lens in, so it makes it pretty obvious as he'll be getting upset.
Another thing that I really noticed, having gone through several summers now, is that the contacts get drier in the warmer weather, so it's very helpful to put eye drops in just so they don't get rubbed out. Also just to wobble them before I take them out with my fingers to take them out.